Welcome to Healthcare Without Networks, a complete overview of Medicare supplements. I'm Clifton Stubbs, a senior broker sales executive with BenefitMall, and I will be your presenter today. By the end of this presentation, you will have a thorough understanding of how Medicare supplements works and why you should offer them to your clients. In order to accomplish that, we will visit a series of topics today, including why offer Medicare supplements, Medicare supplement basics, rules, rates, as well as we'll visit the carrier partners that are available to you through BenefitMall. And finally, I will leave you with a list of resources that are available to you after this presentation ends. Now, the insurance carriers offer Medicare supplements because there are huge gaps in the original Medicare system. If you have viewed the Medicare 101 presentation, this will be a little bit of a review. So let's get started. There is a Part A deductible of $1,156 per benefit period, and a benefit period is defined as 60 days. And if you were to stay in the hospital past 60 days, you would be responsible for $289 per day until you reached day 91, and then $578 per day after that. Part B has an annual deductible of $140, and then after that, you will pay 20% of all Medicare approved charges. In addition, if your doctor does not take Medicare's assigned rate, you can also be charged 15% of the Medicare approved charge as an excess charge. Additionally, skilled nursing, days 0 through 20 are covered by the original Medicare system. However, after that, you can be responsible for $144.50 per day up to day 100, and after that, 100% of the daily cost. Lastly, the last two items most people aren't aware of. If you need a blood transfusion, the first 3 pints of blood, you are responsible for 100% of the cost. In addition, there is no foreign emergency travel benefit in original Medicare. If you're traveling outside of the borders of the United States and you have no extra insurance, you are not covered. You will be responsible for 100% of that bill. So now that we understand the need, let's take a look at why a client would choose a Medicare supplement plan over a Medicare Advantage plan. The value proposition for the client consists of no networks, which means you can go to see any doctor anywhere across the United States as long as they agree to take Medicare, which at last count was about 93% of all doctors. There are no primary care physicians, which means there are no gatekeepers, and you don't need any referrals to go see a specialist. All of these plans are guaranteed renewable, which means that once you're accepted, as long as you continue to pay your premium, they can never cancel your plan. Services are not limited by service area. Now, this is important for people who travel a lot or maybe live 6 months in New York and 6 months in Florida. Medicare Advantage plans have out-of-network benefits if you have an emergency or if you need urgent care. But if you were to injure yourself and be in the middle of a rehab situation, for example, and winter came and you wanted to head down to Florida, you would not be able to continue your rehab in a Medicare Advantage setting. However, on a Medicare supplement, you could find another doctor down in Florida, coordinate that rehab, and go ahead and finish it up. Lastly, these plans are completely portable. So if you move out of a service area or into another state, as long as your carrier does business in that state, you simply call them up, let them know that you have moved, and they will adjust your rate appropriately. Now, there's also a value proposition for the broker. The biggest one being client persistency. Once clients get on a Medicare supplement, typically they stay where they're at. The main reason for that is because the benefits are guaranteed renewable, which means they don't change every year. And as long as your client can afford to pay the premium, typically they will stay on the plan, which makes a lot less work for you in the long run. There are also no major marketing restrictions. On Medicare Advantage plans and drug plans, you cannot cold call anybody. There are limits on what you can and can't do at a marketing presentation. Since Medicare supplements are regulated by your state insurance board and not CMS, none of these marketing restrictions apply to you. And lastly, there's no certification process, which means there are no hoops to jump through and no annual recertification classes that you need to take. Simply, you just need to be appointed with the carrier. In order now that we know why clients need Medicare supplements, let's take a look at some of the basics. Medicare supplement plans are private health insurance plans designed to supplement the original Medicare system, meaning they will pick up where the original Medicare system leaves off. You will also hear them called Medigap plans. Now, these two terms are used interchangeably, but they mean the same thing. So what does it take to be eligible for a Medicare supplement plan? It is very simple. You need to be entitled to Part A and enrolled in Part B. You need to reside in a service area. Now, unlike Medicare Advantage plans, the service area is the entire state. They do not file by individual county, simply by the state that you live in. And lastly, you need to pass underwriting. Now, this is important because underwriting is not like a life policy, for example. It's usually pass or fail. On a life policy, they will ask you 12 or 13 questions to see how much they're going to charge you. If your pocketbook is large enough and you can afford the premium, you will find somebody that will insure you. However, on a Medicare supplement, typically it's a yes or no situation, which means that if you answer yes to any one of those questions, you are not eligible to be covered. Now, currently, there are 11 modernized plans. You have plans A through D, a plan F, G, and plans K through N. The important part to note is all these plans are standardized, which means you'll receive the same benefits regardless of the carrier. The only difference is underwriting and premium. Now, carriers also offer what's called a Medicare Select plan. And the Medicare Select plan has the same benefits as a regular Medicare supplement plan. The difference is when you go to get a surgical procedure or an outpatient procedure at a hospital, you have to use a networked hospital. You can still see any doctor that you choose that takes Medicare, but you have to use a network hospital for a pre-planned event. In addition, in order to get a Medicare Select plan, you have to live within 30 miles of a network hospital. Outside of that, you just are eligible to enroll in a regular Medicare supplement plan. Additionally, there are high deductible plans. High deductible plans, again, have the same benefits of a regular Medicare supplement plan. The difference is you have to meet the deductible before the plan benefits kick in, just like on an HSA, for example. Now, all the plans are standardized across the country, as I mentioned before, but there are exception states. Massachusetts, Minnesota, and Wisconsin have designed their own plans that are available for carriers to sell. They look pretty similar to some of the Medicare supplement plans that are out there. However, you just don't have all of the choices that you would if you lived in some of the other states. Now let's take a look at what some of these plans look like. The benefit grid you are looking at can be found in the 2012 Choosing a Medigap policy, which is available to you at medicare.gov. You will notice that under Medigap benefits, you will see all of the gaps in the original Medicare system that we discussed earlier. And as you move to the right, you will see the different plans in which of those gaps that they cover at 100%. If you look at column F, you will notice that Plan F covers all of the gaps in the original Medicare system. This is the plan that is most typically sold because I like to refer to it as 100% coverage. If your client has a Plan F, they will not see another nickel out of their pocket outside of their premium for any of the Medicare approved charges. There are no copays or coinsurance when they visit their physician. You will also notice as you move to the right hand of that grid that there are 4 plans that have some cost sharing amounts for people who would like to lower their premium in exchange for taking some of the risk of their medical costs. Now you will see that Plan K and Plan L do have an out-of-pocket limit. which does limit their exposure. You will also notice that the high deductible Plan F has a deductible amount in 2012 of $2,070. Now that we've seen what Medicare supplements do cover, let's take a quick look at what they do not cover. Medicare supplements do not cover long-term care, dental and vision care, hearing aids, eyeglasses, private duty nursing, or prescription drugs. I will give you my 5-second commercial for BenefitMall. Your clients need coverage for all of those areas, and if you do not have products in your bag that currently assist your clients in covering those needs, please call me at the end of this presentation and I will help you get set up with those products. Now let's take a look at rules. You cannot have a plan that interacts with the federal government without having a set of rules, and Medicare supplements are no different. All Medicare supplements must comply with federal and state laws. Additionally, carriers must offer a Plan A and C or F in every state they go into. Now, we noted before that there are 11 modernized plans, but not every carrier will offer all 11 plans in every state they do business in. However, they must offer at least a Plan A and a Plan C or F. Now, as I mentioned before, these plans are guaranteed renewable. It's not only a benefit, but it is a law. Again, as long as you pay your premium, they have to renew your policy. Guaranteed issue. During guaranteed issue, you cannot be refused coverage. You do not have to wait for coverage to start. The carrier cannot rate up your policy based on your health status, and there are no pre-existing conditions with prior credible coverage.